When someone goes to see a doctor, they usually come in with one specific problem, right? A symptom. But that's never the whole story. It's really just the first page of a much, much deeper story. So today, we're going to explore the art of patient assessment. We'll follow three very different people to see how clinicians look beyond the illness to understand the whole person. So our first puzzle starts with these really troubling words. We have a 27-year-old man, he's confused, he feels disconnected, and his main complaint isn't physical pain, but this deep psychological distress. Next up, we meet a 22-year-old. She's a student and a mother. Now, her problem is physical, it's predictable, and it's completely disruptive. Her body is basically in revolt every single morning. But the reason why? That's a total mystery. And for our third story, we have an 88-year-old woman. On the surface, this one seems pretty straightforward, an injury from a fall. But as we're about to see, a simple fall is almost never that simple, especially in a life that's been lived so long. Okay, so let's dive in. To solve these puzzles, the very first step is to look right past the problem they came in with and ask a really fundamental question. Who is this person? Their history, their life, their world, that's where the real clues are hiding. Let's start with our 27-year-old. His entire life has been turned upside down. Just 2 weeks before he landed in the hospital, he moved all the way from Texas to Alabama. He left his girlfriend, all his friends, his entire support system, gone. He's living with his brother now, and he just feels completely isolated. This isn't just a move. It's a full-blown social crisis. Now compare that to the 22-year-old. She is the total opposite of isolated. Get this, she's a wife, she's a mom to a toddler, she's a junior in nursing school, and on top of all that, she runs a small business on the side. Her life is packed, for sure. But you have to wonder, what's the pressure like trying to juggle all of those roles? So what we're seeing are two women at completely different stages of life. The 22-year-old is right in the middle of building her world, career, family, relationships. The 88-year-old, on the other hand, she's in a season of reflection and adjustment. She's dealing with declining health and the recent death of her husband. Their core life challenges are worlds apart, and that context is absolutely crucial. So after getting a handle on their life story, the investigation moves to a head-to-toe inventory of their physical symptoms. This is where you really listen closely to what the body is saying, and you often find patterns that the patient themselves hadn't even connected. For the 27-year-old, this is the most alarming find. 30 pounds. He lost 30 pounds in just 1 month. This is not just about feeling sick in the head. This is a massive biological red flag. It's pointing to something severe, something physical going on underneath it all. The 22-year-old story is different. She feels exhausted, weak, anxious, but a really thorough physical exam finds nothing wrong. This disconnect is the key clue. Her body is just screaming stress, even though, by all the typical measures, she's physically healthy. And for our 88-year-old, this one number says it all. 8. That's how many different medications she takes every single day for chronic conditions like diabetes and hypertension. This tells us her fall didn't just happen in a vacuum. It happened to a body that was already managing a very complex web of medical issues. Okay, so we've heard their stories, we've reviewed their symptoms. Now it's time for the objective data. Let's take a look at what the lab work shows, because this is what turns the story from a subjective experience into cold, hard biological fact. The labs for the 27-year-old are seriously alarming. His lymphocyte count is critically low, and his absolute CD4 count is less than half of what it should be. At the same time, his BUN is high, which suggests he's dehydrated, probably because he's barely eating. There's no doubt about it. Something is seriously wrong with his immune system. So what does that mean? Well, the CD4 count is basically how you measure the body's key infection-fighting cells. A healthy count is over 720. His is 359. This means his immune system is severely compromised. His psychological symptoms are happening right alongside a profound biological collapse. So now we can start to put all the pieces of the puzzle together. This is that moment of synthesis, right? It's where all the clues, the personal story, the physical symptoms, the lab data, they all come together to form a complete picture of each person's health crisis. For our 27-year-old, the picture is just devastating. Biologically, his body is failing. Psychologically, his mind is in crisis. And socially, he's completely alone. And this just perfectly illustrates how these three things can get locked into a vicious cycle where each one makes the others worse.
For the 22-year-old, we can see so clearly how her intense psychological and social stress is actually showing up physically. Her nausea and vomiting aren't caused by a stomach bug. They're caused by the overwhelming pressure of her life. Her body is keeping the score. And for the 88-year-old, her broken hip is really the end point of a much deeper story. It's an injury that's happening to a frail body, a grieving heart, and a life that has lost its main pillar of support, her husband. The fall wasn't just an accident. It was a consequence of her entire situation.
See, understanding the full picture isn't just some academic exercise. It's what allows for a truly personalized plan of action, one that treats the person, not just the symptom they walked in with.
So the path forward for each of them is totally unique. The 27-year-old needs urgent psychiatric care and a full investigation into what's wrong with his immune system. The 22-year-old, she needs stress management techniques, not more stomach tests. And the 88-year-old, yes, she needs her hip fixed, but she also needs pain control, help with her other illnesses, and, just as important, compassionate support for her grief.
And all this really leaves us with a final thought, doesn't it? These cases show that a symptom is never just a symptom. It's a message from a life that's being lived. And it kind of makes you wonder, how much of our own health story is being written not just in our bodies, but in the day-to-day reality of our lives?